right. I'd like to welcome everyone. My name is Horst von Rakum. I'm a professor of biomedical engineering at Case Western Reserve University, and it's my honor and privilege to introduce you to the Open BME seminar series. So if this is your first seminar, or if you've been to several of these, just want you to know that it's Open BME is a consortium of 7 different universities, 7 different top BME programs within the country that are working together to try to collectively expose their students to some of the top leaders in the biomedical engineering field. Today, Case Western Reserve University has the honor of hosting the speaker, and just want to use this slide to introduce upcoming speakers. So Case is hosting next week's speaker as well, Dr. Daniel Bassett from University of Pennsylvania. Anyway, one logistics event. So you may have noticed the chat is disabled, but we have a Q&A feature enabled in the bottom of your screen. So if you along the way have questions, feel free to start typing them into Q&A. If you want to keep track of other people's questions, you can upvote or downvote other people's questions, just like in Twitter or Reddit or whatever social media platform you like to use. And at the end of the speaker's presentation, she'll have access to the questions and we'll be able to get to the questions. So if you like a question and want to vote it up, feel free to do so. All right, with that, I'm going to introduce Professor Andrew Rollins, a colleague in my department, and he'll introduce today's speaker. Professor Rollins.
Thank you, Horst, for that kind introduction. I'm honored to have the chance to introduce our speaker today. Adriana Velazquez Bruman earned her undergraduate degree in biomedical engineering from Universidad Iberoamericana in Mexico, and then her master's degree in clinical engineering from Case Western Reserve University. She's throughout her career served in many functions through the healthcare systems in Mexico and internationally, including biomedical engineering and clinical engineering positions. Then serving in the Ministry of Health in Mexico, internationally in the Pan American Health Organization and the World Health Organization, where she is currently a senior advisor and focal point for medical devices. I told her I think she needs a flashier title. She's really the boss of biomedical engineering at the World Health Organization. That may not be clear from her title. She's served in many professional and honorary positions. She served as the president of the Latin American Regional Council of Biomedical Engineering, president of the Mexican Society of Biomedical Engineers, chair of clinical engineering at the International Federation for Medical and Biomedical Engineering, and many other positions. Among her awards that have honored her include the First International Clinical Engineering Award, Distinguished Alumni Awards from her alma mater, Clinical Engineering Individual Award from the International Federation for Medical and Biological Imaging, Humanitarian Award from the Association for the Advancement of Medical Instrumentation, and so on. In short, our speaker, Adriana, is a very distinguished professional and alumna of our department here in biomedical engineering at Case. We're very proud of our association with her. On a personal note, I think the way I met Adriana is a little bit telling of her stature. I met her at a biomedical engineering regional conference in East Africa hosted by Makerere University in Uganda. And I was there to give a presentation about work in collaboration with Makerere University's biomedical engineering department. But she was the keynote, and I I felt like I was at a rock concert when she walked in the room. Everybody knew her and everybody was so excited to see her. So many in the room knew her because she had personally helped them. And we in the US, have our love-hate relationship with the FDA, but imagine if you were working in a country or region that had no functioning regulatory system. Who would you turn to? Well, for many people in that position in the world, they turn to Adriana, and she helps them and their programs and their ministries and their governments. So we're very honored to have her time, and I won't take any more of it. So please help me welcome Adriana Velazquez. Thank you.
Thank you. I don't know what happened. Thank you very much, Andrew, and thank you all the organizers for inviting me to give this talk today. I'm very proud to be WHO, but I'm also very proud to be alumni from Case Western Reserve University. I'm very glad to be with all of you today. So without any further ado, I will start my presentation. So I'll share my screen. Just make sure everything works well. Is that working?
Yes, looks good.
Okay, thank you very much. Okay, so the title of my presentation today is, as the world gets smaller, how can we expand the biomedical engineering impact to global health? So I have the agenda for you, and it's the world really is getting smaller. Where can we as biomedical engineers have impact? Local, regional, and global health. Which are the challenges that we have? Well, many. We have infectious diseases, as the world faces today, but we still have non-communicable diseases, cancer, diabetes, cardiovascular diseases, they're there. And also all the diseases related to the health, life course conditions, pregnancy, reproductive health, maternal, newborn, child, and now aging. Of course, the medical technologies are there to protect us, to prevent diseases, to diagnose diseases, to treat diseases, to monitor, rehabilitate, and palliate. So we have a broad spectrum. And the areas of work are many. So it is on the innovation, regulation, selection, procurement, supply, training, and use of medical devices. That will be the topic of my talk, but I just put some nice images here to remind me of the time that I was at Case Western Reserve University. Then, as Andrew, and thank you for the introduction, I was in Mexico in private and public hospitals in the Ministry of Health in Cenetec, and I'm really glad that Cenetec still is there. In the government of Mexico. And then this is a picture I took just 2 weeks ago that we launched the third essential in vitro diagnostic list in WHO. So let's go a little bit backwards. We are in 2015, and we imagine the United Nations get together and they say we need to have sustainable development goals. We need to be reached. They need to be reached by 2030. So there's one that is called Good Health and Well-Being, which, by the way, it is an EKG. It simulates an EKG. So our medical devices are there and the EKG is there. And then, of course, health has relation with many others. So, of course, it's related to industry, innovation, and infrastructure, just below it. And it could also, if we have good health, it will reduce inequalities, will increase for example, we have solutions about affordable and clean energy for hospitals, etc. So these are the sustainable development goals, and the idea is to reach them in 2030. Later, 2017, 2018, we had a new Director General coming to WHO, Dr. Tedros, and then from Ethiopia. And we started developing in WHO, along with the member states, the 3 billion target. So it is universal health coverage to get everybody covered for health. They cover 1 more billion people from health emergencies and 1 more billion people of health and well-being. Those were the goals back then.